So the next topic is trachoma. Trachoma is a chronic keratoconjunctivitis which affects the superficial conjunctival and corneal epithelium. It was previously called Egyptian ophthalmia, but it affects populations who are at risk in several places apart from Egypt. So what are these risk factors? Poor sanitation, unhygienic living conditions, and patients, especially when there are a lot of flies, etc. And the spread is by fomites, fingers. These are the common ways of spread. The incubation is usually about 3 weeks. So trachoma classically is caused by Chlamydia trachomatis of the serotypes A, B and C. And classically we have intracellular inclusion bodies which are called Halber-Stedler-Provasic bodies, HP bodies in short. So this is very important because Chlamydia trachomatis, although the disease has its origin so many years back, till today it continues to be a point of importance both for questioning clinically, theoretically or even in patients. But more likely now we are seeing patients with complications or sequelae of trachoma rather than active trachoma itself. So what is it that we need to look for? In these patients, you can have an enlargement of the papillae and follicles. So this is one of the unique conditions where follicles can grow very large. You can have very large sized follicles in the eye. We need to examine for this. Follicles usually occur as lymphoid aggregates. Of course, we don't see it as lymphoid aggregates. We see it as small nodular elevations, usually whitish in color. Papillae are flat-topped elevations and they occur in the upper torsus. So like you can see in the picture, if you evert the upper lid, these areas that you're seeing probably are the papillae. And again here also you're seeing papillae, and there is also a conjunctival congestion. And Alt's line are subtarsal scars that occur in the tarsal conjunctiva. In the cornea, there can be superficial or an upper involvement. So what you're seeing in this picture is the superficial and upper area of the cornea which is affected. These Herbert's follicles are areas of the follicles itself that are present in areas in the superior and upper part of the conjunctiva. And after some time, when these follicles resolve, they can cause these depressions which are called Herbert's pits. Herbert's, this is a pathognomic feature of trachoma. So all the features that you're seeing in the slide are very, very pathognomic of trachoma. The other thing is called trachomatis pannus. Basically, the word pannus means cellular infiltration with vascularization. So there are two types of pannus, progressive and regressive pannus. So progressive pannus is when, if this is a cornea, progressive pannus, there'll be blood vessels and there'll be infiltrations a little ahead of the blood vessels. Whereas if it's a regressive pannus, you have blood vessels and you have cellular infiltrations that are associated with the blood vessels. So point here is, if it's progressive, there will be a growth of blood vessels anterior to the cellular infiltration. Causes of pannus can be, one of course this is the first cause of pannus. Apart from that, you can have pannus in tuberculosis, you can have it in syphilis, you can have it in leprosy, and you can also have it in viral infections. So we have to look for pannus, we have to look for areas of infiltration. If blood vessels continue to grow anteriorly, you know that it's a progressive pannus.